Hello, everybody. I'm Dr. Matthew Riley. I'm an interventional pain specialist at OrthoVirginia in Lynchburg, Virginia. I'm one of 4 interventional pain specialists at our location here in Lynchburg, Virginia. I also work with Dr. Salah, Dr. Salajaga, and Dr. Tusi. And I have the exciting opportunity today to talk to you about spinal cord stimulation for diabetic neuropathy pain. So what is spinal cord stimulation? And so spinal cord stimulation is a type of neuromodulation. What that means is that it's basically affecting how nerves are sending their signals. And this is something that's been around since 1980, and it is continually evolving. The type of technology that's going into it, the type of programming, the hardware itself is always making continual advances, getting better and better as our technology advances as well. And so continuing on with the what is it? What is spinal cord stimulation? So what spinal cord stimulation is we're placing usually 2, sometimes 1, electrode and a set of electrodes above the back of the spinal cord. And this sits outside of that protective dural sac. And these electrodes are sending electrical signals back and forth between each other. That's manipulating, electromagnetic fields. And these electrodes are then changing the way that nerves are kind of sending their signals. But those electrodes, they're placed in underneath the bones at the back of the spine, but outside that protective dural sac. Those are then tunneled back to a battery. That battery is implanted into the body in its final stage. And that battery is what's sending those electrical signals. That battery has a very smart brain and computer inside of it where it can change what kind of signals it's giving and can be reprogrammed in many, many different ways. The electrodes themselves are positioned very specifically over a portion of that spinal cord in order to target different areas of pain in the body. And for usually diabetic neuropathy pain, we're targeting pain more so down in the feet, the ankles, and the lower extremities. Again, that battery can be programmed in many, many different ways to send a combination of different signals. On that next slide there is a little illustration. And so you can see that neurostimulator that's labeled there, that is the battery device. It contains the electrical charge. Some of those battery devices are rechargeable, some are non-rechargeable, and that's kind of just dependent on the patient and becomes a conversation with your doctor later on. But that also illustrates the leads that go from that battery. Those leads are tunneled underneath the skin. They then are tunneled into the epidural space underneath those bones on the back, but outside that protective dural sac. Those leads are held in place in a couple different locations, anchored to some of the tissue so that they don't move around as best as we can. And then moving on, so how does this work? Again, I was just touching on that earlier, but these electrodes are sending these electrical signals. Those electrical signals are changing the way that the nerves are either sending signals back up to the brain. They might actually change the way that nerves from the brain are sending signals down to the nerves at the spinal cord. And then they may actually be changing how the neurons themselves are beginning to interpret signals, what kind of proteins are getting made in those nerves, some genes that are getting expressed in those nerves. There may actually be some evidence that they're changing activities of other nerves in the central nervous system, more specifically the glial nerves. But overall, it's changing both the sending and receiving of some of those signals in order to help treat the pain that you're feeling in a specific area of the body. And so this has been around for a long time, and it's had specific indications so far that are really targeted to nerve pain, or what we call neuropathic pain. And that can be things like chronic radiculopathy, or sometimes called sciatica. that pain that's shooting down from the back down into the legs. It's been used with lots of success for patients who are having continued back pain after back surgery. A little bit more recently, it's been used with success for patients that are having more specifically back pain. And then it's been used with great success, again, for that neuropathic pain. And neuropathy fits within that category of neuropathic pain. And neuropathy can come from a lot of different causes. And so vitamin deficiencies, environmental exposures, even things like HIV, alcohol, and then diabetes can all lead to peripheral neuropathies. And those can be polyneuropathies, meaning they're affecting multiple nerves. And they can be mononeuropathies, meaning that they're affecting single nerves. And diabetic neuropathy is generally considered a polyneuropathy, a length-dependent neuropathy, more so starting to affect the distal extremities. And spinal cord stimulation has been found to be effective in terms of a treatment for folks who are having that painful diabetic neuropathy. And so, could this work for you? And that starts off with the question is, do you have a diagnosis of neuropathy? Are you experiencing that painful pins and needles, burning sensation, aching sensation in the toes, in the feet, the ankles, the lower extremity? And then have we been able to find a cause for that? And so sometimes we can't. Sometimes neuropathy is what we call idiopathic. We haven't been able to find a cause for that. Sometimes we know that it's from diabetes, or at least we believe that it's from diabetes because we haven't found any other cause. And then we know that you do have diabetes. And then there are some of those other things that we mentioned. So chemo-induced neuropathy, HIV, alcohol, vitamin deficiencies, environmental exposures can all be causes of neuropathy. And so if you've been diagnosed with neuropathy, then this is a possible treatment for you. Have we ruled out other potential causes? And those are things like an irritation of a nerve in the back, a radiculopathy, or another cause for having kind of numbness and tingling there. And then, is this painful enough? The symptoms that you're experiencing, is it painful enough to keep you from doing things you want to do? Is it keeping you from doing things you need to do? Is this pain impacting you negatively? Then this could be a treatment for you as well. Have you tried the medication? So oftentimes the first things that we're trying to treat neuropathies are neuropathic medications, and that can include gabapentin, Lyrica, SNRIs like Cymbalta and venlafaxine, and then there's many other neuropathic medications that typically I would suggest folks try before thinking about something like spinal cord stimulation. And then another important thing, so because spinal cord stimulation, putting in and implanting a spinal cord stimulator is a surgical procedure. We want to make sure that your risks are as low as possible. And being diabetic automatically includes some higher risk of complications of things like infection is the biggest one. And wound healing is another important risk that we think about, especially for folks who are diabetic. And so we want your blood sugar as controlled as we can be, and ideally that A1C would be 8 or less. And then smoking and using tobacco products actually has a negative impact on your wound healing as well. The nicotine actually can cause some reduced blood flow through its vasoconstriction effects. And so we do like for folks to stop smoking and cease using tobacco products. And that improves your wound healing, improves the success of having a good healed wound, a successful implant, and for pain relief afterwards. And so what kind of evidence is there for this? So again, spinal cord stimulation has been out for decades. And there is a growing body of evidence specifically for the indication of diabetic neuropathy. We were studying this nearly a decade ago, back in 2014, starting with randomized controlled trials. And we do have follow-up studies over the course of that 8 to 10 years as well afterwards. And so of these studies, and what we're seeing is for individuals who undergo the trial, and we'll talk more about the process in just a few minutes here, but for patients who go to the trial stage, we're seeing probably about 80% of individuals seeing a really good response, having very good pain relief with the trial. And then those patients go and they have the system permanently implanted. And then of those patients that have that permanent implantation, we're seeing 70% of those patients are having at least 50% or greater pain relief. And when they're reporting these kind of numbers, they're actually comparing this to the best medical therapy. So that's those neuropathic medications, gabapentin, Lyrica, and those kind of things. And most of those patients were reporting not much in the way of changes in their pain relief. And so the patients that were getting the implantation, having the spinal cord stimulation system, were reporting much greater pain relief with that system compared to the medications. Now, again, it's not every patient. And so there are definitely patients that either don't respond during the trial, and then there are still some patients that don't respond as well even after implantation. And we are seeing that over that 8 to 10 year follow-up, still about 55 to 60% of patients who have the system are still having that meaningful pain relief even 8 to 10 years later. And again, this is still comparing to that medication. Really, the best alternative therapy that we have for neuropathy are those medications. And we're seeing an improvement over those medications with spinal cord therapy. So what is this process? So overall, if you feel like you meet these criteria, if you have a diagnosis of neuropathy, and you've tried these medications and it's still causing you pain and discomfort that's getting in the way of your day-to-day, things that you want to do, things that you need to do, and you're interested in talking about this new type of treatment for you, then you make an appointment with an interventional pain physician. You discuss the type of symptoms that you've been having. We go through what medications you're currently taking. We go through the medications that you've tried in the past. We overall learn more about you in terms of your medical history, and that gives us ideas about what risks there are to you in terms of undergoing both a trial for a spinal cord stimulator and the minor surgical procedure that implants the spinal cord stimulator. And then we make sure that we've ruled out any other kind of causes for your symptoms and that it's appropriate to move forward with a spinal cord stimulator. And certainly at this meeting, we're answering any kind of questions that you have about what it is, what's involved with the process, the risks that are involved, and things like that. At this meeting as well, we give you information for the main manufacturers of spinal cord stimulators. And there's 4 main manufacturers out there, and they all have their pluses and minuses. But we certainly give you that information. And in fact, there are representatives from those companies that you can call and you can talk with for really as long as you want to. They're always happy to field any kind of questions and talk to you more about how that system, how that therapy can be useful for you and what else is involved with it. And so if together we both agree that you're a good candidate for spinal cord stimulation, there's a couple other steps. And so we usually get an MRI of the thoracic spine, usually the lumbar spine as well, in terms of ruling out other potential causes of your symptoms. But the MRI of the thoracic spine is there to make sure that there is room for that system to sit outside of that dural sac, but underneath the bone. We don't want there to be any stenosis in that area because then our system, the little leads that sit back there wouldn't be room for them, and it wouldn't be safe to put that in a certain way. But even if there is stenosis back there, there is still potential other option that we have if we both agree that spinal cord stimulation is a good treatment option. We do have you meet with a pain psychologist, and this is a very important, really, step in this process. And it's a step more so to talk about what are your expectations in terms of this therapy? What do you feel like it's going to do for you? And making sure that everybody is on the same page in terms of how much relief we feel like we're going to get, what kind of, again, pain relief we're expecting, how long it's going to last, and all those things to make sure that it is going to be the best therapy for you, that it is going to work for you. It's going to be a long-term solution for you. If everything is going well, then the next step is a trial. And what that is it's typically an in-office procedure, or at the very least, it's a same-day procedure. You come in and the test leads, and so these are percutaneous, mean placed through the skin, is placed into that space where the ultimate placement of those leads would be. And so it's very similar to an epidural injection. Those leads are guided in with a epidural needle. They are then guided up to the location of over that spinal cord where we want to stimulate. The leads are tunneled out from the skin. Where they come out is dressed. It's all done under sterile conditions. It's kept clean, a sterile bandage is put over it. Those leads then go over to a temporary generator that is external. It's taped to your side. And then you get to test out the system. So you get to work with a representative who's going to call you every single day, even talk to you multiple times a day if you want. And you get to use that system usually for about 7 days. Some folks, it's a little bit shorter, around 5 days. Sometimes it's a little bit longer, but normally 7 days is the longest that we do. And you get to see whether or not this is really going to work. And you get to try out different types of programs with that stimulator and different settings with that stimulator. So we really get to see, is this therapy going to work for you? At the end of the 7 days, everything comes out. It's very easy to remove. The leads themselves just pull right on out from underneath the skin. Everything closes up, heals up very easily. And then if you have really great relief, then we talk about the implantation. And that is something that myself, Dr. Salajaga, perform here. And then we also have really great relationships with local neurosurgeons in Lynchburg, as well as neurosurgeons up in Charlottesville and UVA that also do the permanent implantation. And that procedure is similar to the trial, but instead of having things kind of tunnel back out and outside the skin, then the leads are placed within that epidural space, and then they're tunneled underneath the skin, and they go over to that generator that's placed underneath the skin in a little pocket that sits either above your bottom or kind of below your belt line and stays in place. And then after that implantation, we follow up with you as often as you need. You always have access to your device representative in order to go through different types of programs, troubleshoot any issues that you're having, and ensure that everything's working properly. So, what kind of questions do we have?
Thank you so much, Dr. Riley. We do have a lot of questions. So The first one is, if you have neuropathy that is from another condition other than diabetes or idiopathic neuropathy, will this still work?
This could certainly still work. And so neuropathy, again, is a neuropathic type of pain. And we know very well that spinal cord stimulation works for neuropathic type of pain. And so even though you don't have a diagnosis of diabetic neuropathy, if you do have a diagnosis of neuropathy, either idiopathic or from another identified cause, this could still be a treatment that can work for you, especially if you've gone through and tried other medications and then the pain is still limiting what you want to do and need to do. Then certainly this is still something that I'd be very happy to meet with you and talk about this as a treatment option.
Thank you. Is it covered by insurance?
And so the indication of diabetic neuropathy, so using spinal cord stimulation for the indication of painful diabetic neuropathy, is generally recognized by insurance and covered by insurance, as well as the indication of neuropathic pain. So other neuropathies are generally covered by insurance.
Thank you. If somebody already has rods in their spine for a different condition, can the spinal cord stimulator still be used?
Potentially. And so it does depend on where exactly the rods are placed. So usually for spinal cord stimulation targeting the lower extremities, we would enter the epidural space around the T12, L1 or T11, T12. And that can still be shifted or moved a little bit, depending on what's going on. And then those leads are typically tunneled upwards. And so that might be a little bit of a case-by-case basis, but that doesn't necessarily preclude you from having it. And certainly spinal cord stimulation has been used very often for patients with that kind of continued back pain or continued pain after back surgery. And certainly those patients have hardware and other kind of devices.
Thank you. What is the difference between diabetic neuropathy and neuropathy caused by spinal surgeries?
So sometimes neuropathy caused by spinal surgery. So if you started to develop numb, tingling, pins and needles after a surgery, that may be related more so to an irritation of a nerve closer to the spine and the nerves that are directly coming out of the spine, versus a peripheral neuropathy is more so a pathology involving the nerves further out in the body, the peripheral nerves. There can still be utility of spinal cord stimulation to treat either one. So chronic radiculopathy is an indication for spinal cord stimulation, as well as the peripheral neuropathy, diabetic neuropathy.
Thank you. If someone already has some kind of spinal stimulator for something they're calling it a spinal order, can another one be added for neuropathy?
So for individuals who already have a spinal cord stimulator in place, probably one of the best things to do initially is talk to either the doctor or the representative that's been helping you with that spinal cord stimulator. And they can oftentimes change the programming in that spinal cord stimulator to see if they can start to cover different areas of the body. And then if it's not covering a specific area in the body that you want to be covered, there are sometimes ways to make revisions and change the areas that those electrodes are overlying. It would depend on the type of device that you have as well, in terms of what can be changed or what can be optimized.
Thank you. You mentioned that some of the devices are rechargeable. How would that work?
Yeah, so many devices and all of the device companies, I believe, offer a non-rechargeable and a rechargeable type of battery system. And most of the systems are going to last 9 to 10 years. And even the non-rechargeable batteries last relatively that long. And it's all dependent on the type of programming and energy that's needed to achieve the pain relief that we want. But recharging is typically done with a induction device. So say you're sitting at home at the end of the evening watching your TV shows. You just have a little induction device that sits over top of the battery. It's typically a little magnet on it, so it'll kind of keep place on there. and you sit there maybe 30 minutes to an hour and recharge the device. Oftentimes you're going to have a remote that's also going to show you the battery level and can tell you when it's recharged fully or when it's getting lower.
Thank you. If someone has pain and tingling in their arms and hands, is that a type of neuropathy?
It can be a type of neuropathy. And there are, again, many different kinds of causes for different numbness and tingling in different places. That can be related to peripheral nerves in the arms, oftentimes numbness and tingling specifically in the hand. We think of things like carpal tunnel and ulnar neuropathies first. And then, of course, there's also cervical radiculopathies that can cause it. Diabetic neuropathy often can cause the numb tingling in the fingers and the hands. That's why we call usually that distribution the stocking glove distribution, if you've heard that before. And spinal cord stimulation can be used for pain in the hands and the arms. Typically, that is placed at the cervical spinal cord. That is not something that I do at that level, but if that is some symptoms that you're having and we think that spinal cord stimulation could be a good option for you, then I am absolutely going to try to get you in with somebody who can do it.
Thank you. Is there a chance that you would damage the spinal cord doing this?
So there's always risks with any type of procedure. And the main risks, anytime a needle, incision, anything like that is done, is bleeding, infection, and damage to something. And thankfully, the risk of infection, the risk of bleeding are fairly low. Now, any individual, again, with diabetes, their risk of infection and wound healing is, the risk of infection is a little bit higher. Wound healing can be a little bit more difficult. We are around the spinal cord, so in that epidural space, we're next to the dural sac. And there are times, and there's documentation that dural sac can get poked into. That's definitely one of the risks. Sometimes it can be torn in small areas, and it is exceptionally rare, but it is possible for the spinal cord to be contacted either by one of those needles or one of those electrodes. Again, it's exceptionally rare for that to happen, but we are working in that area and it is a possibility.
I want to go ahead and answer a question. So Dr. Riley is in the Lynchburg area, but we do have providers across Virginia who provide this service. You can go to orthovirginia.com to find out more and give us a call to make an appointment.
I have every confidence in all my colleagues across the state that can help take care of folks for this type of diabetic neuropathy pain and do things like spinal cord stimulators for you.
Thank you. So what is the amount of time between a trial and a surgery usually?
Sure. And so that amount of time can vary for the individuals, but normally once the trial is completed, we let your back heal up from that trial, and that can take on average about a week and a half for everything to heal on up. They're incisions, it's not really even an incision that's made for the trial. They're small little puncture sites where that needle went in. On average, it's a month or less, but everybody's a little bit different in terms of getting optimized. But it's usually not an extended period of time between trial and implant.
Thank you. Can it help with, let's see, this is PHN from shingles?
So post-herpetic neuralgia. It may be able to help with that. It would depend on where that post-herpetic neuralgia pain is. That is a type of neuropathic pain. It's less common for that to be in the lower extremity and a little bit more common for that to be along the trunk or upper body. And there may be treatments that are related to neuromodulation for post-herpetic neuralgia, but that would be a little bit more on a case-by-case basis.
Thank you. Do you change where you put the electrodes on the spinal cord covering depending on where the pain is?
Small degree. And so there is a general area between kind of the T8 to T10 distribution is our main target for the lower extremities. And there may be a little bit of shifting kind of between there. And sometimes that trial period helps us find exactly the areas to be targeting along the spinal cord. But generally, targeting those lower extremities is going to be in that area for most everybody.
All right. Thank you so much, Dr. Riley. If we didn't have a chance to answer your comment on Facebook during the live, we will answer it later in the comments section. Dr. Riley, would you like to close?
Sure. Thank you, everyone, for coming out and being part of this Facebook Live event. I look forward to getting to meet anyone who wants to come and talk about this as a possible treatment for you. Remember that you can find more information about myself, my colleagues, the different areas all across Virginia where OrthoVirginia interventional pain specialists can help you with this at orthovirginia.com. And again, thank you all. I hope to see you all. I hope to help many of you as best as I can.